Hi everyone, welcome to my Q&A Monday. My name's Hannah. As most of you know, I'm the accountant for doctors. And today we're having a special session. So today we invited our special guest, Dr. Ali, to the Q&A live. And today we're going to talk about doctors of the future, how the technology can change the way we deliver healthcare in the UK. So Dr. Ali is one of the founders for DocNoc, where today we're going to talk about your business, your idea. And in the meantime, if you do have any questions, be free to comment. So be free to pick our brain. Okay, so Dr. Ali, to start with, perhaps just briefly introduce yourself and to let people to know who you are.
Of course. First of all, I would like to thank Hannah for inviting us. And I'm Dr. Ali Joma. I've been a qualified doctor since 2002. Been working in the NHS since 2005. I worked mainly, I did general surgery, and now I currently pivoted a little bit. So I'm doing some accident and emergency work, and mainly I'm working on DocNoc. DocNoc is a new app, a new way how we practice medicine. I think we will talk a little bit more about it later with Hannah, when Hannah starts to ask the questions.
Yeah, of course. So as we know, like healthcare technology is actually sort of a new thing. Actually, lots of doctors, they become like quite entrepreneurial. So what is your story, like how you come up with the idea?
The idea started really when working in the NHS, and year after year we start to notice that there is an increased demand on the services and there is lack of resources to meet this demand. And that actually created like a group of patients, which I usually call them like the lost tribe of patients. These are patients that are not very ill, they don't need emergency care, and they don't have cancer that they need like specialist emergency care at home or in hospital. So the patient that falls between these two groups are mainly the patient that struggles the most. And the reason being is not because the NHS is not good. The NHS is brilliant, and it's almost been brilliant, and still the staff work, really hard, and I'm still working in the NHS. The problem is that because there is a lack of resources, that creates delay in the services. When you have a health concern, and if you have delay to have answers about your health concern, that creates a lot of anxiety. And this anxiety leads to other problems in personal life and at work. So this group of patients usually, they keep asking and demanding a quickest and more easier access to healthcare. And obviously with the evolving technology currently, digital health is booming. A lot of things happening around the world, and especially with all the on-demand services that are available outside medicine, like Uber, Airbnb, you can get anything on demand these days. So I thought to myself, there must be an easier way to get the service to these patients. So that's how DocNoc came across my mind. I thought we can use digital technology to ease access to healthcare, and we can basically do that by giving the choice to the patient to see a doctor when and the way they want to see a doctor, but at the same time looking at the doctor's side as well to give them flexibility to work. So the idea started back in 2015, but the actual work started in November 2016, and that's after I met my business partner, Dr. Noor Al-Khatib.
Just come to the front, say hi.
Hi everyone. Yeah, I'm Noor Al-Khatib, and hopefully in the coming months or weeks we'll be doing more sessions on operations in the DocNoc and give you more details about our background. But today is the whole space. We will be introducing DocNoc, and Ali will speak more about the whole concept. Thank you. Thanks, Hannah.
You're welcome.
So yes, when I met Dr. Noor, we combined two types of skills, which I felt it was perfect for this type of an adventure or vision. So I have a background working clinically in the NHS and private as well, and Dr. Noor has a background of bioinformatics and business administration. So we combined these two efforts, and we started DocNoc in November 2016, and that's how we started. And now we are at the level where we are launching our services and trying to reach out to doctors and patients.
Yeah, that's brilliant because, we see the problem,
Yes.
like actually the patients in between,
Yes.
like from the ones well or between the ones who doesn't have a problem and to the ones who have like extreme problem.
Yes.
The ones in between. And these ones are in demand. And also for the doctors, on the other side, for the doctors, they can have a new way of working.
Absolutely.
Yeah, that is
especially
a really...
this group of patients. These patients, they really get into a vicious cycle sometimes. If you have a concern and you have to wait 6 months or 3 months or 4 months or even a month sometimes to see a specialist, that can sometimes even ruins people's life because they can get into a cycle of anxiety and depression, and they can stop working until they get the answers. So yes, this group really need to be served. If you're having a heart attack and you go to accident emergency, you will get all the services at your, straight away. Or if you have cancer, for example, you get all the cancer treatment and quick referral.
Yeah.
But if you are in between, that's where the struggle starts, and that's where DocNoc wants to make a bit of a change.
Yeah, that's brilliant. So how does it work? Like, of course, like Dr. Noor has said, we'll talk more about in more details in future sessions. But just to give a brief idea, how does it work? Of course, we have the link in our description. If you want to check out the link, and then perhaps later on we'll talk about how you can connect with Dr. Ali, how you can connect with DocNoc and find more about it. So how does it work?
So the idea is pretty simple. There is 3 ways you can actually see a doctor these days. So it's either you go and see them in their clinic, or you ask them to come and see you at home, or you can have a video consultation, what we call telemedicine, which is evolving now these days. So we wanted to put all these services onto one platform for me as a patient, that I can choose what service I want and how I want it. For example, if I want to see a specialist through a video call, or if I want to see a GP to come and see me at home. So the service give the patient a chance to choose which service they want to use and which specialty they want to see. So we usually provide primary, urgent care, specialist care, and mental health care. So that's from the patient side. From the doctor side, any doctor can join us as far as they are registered. Doctors in the UK are fit to practice, and they have a full GMC registration and specialist register. They undergo a compliance procedure, which is make sure all these doctors are fit to be on our platform, and then they join us. And once the doctor joins us, they can work anytime they want. So they can choose what service they want to provide. They can choose if they want to provide a video call, a home visit, or a clinic appointment if they have their own private clinic. And that gives the flexibility for the doctors to choose when they want to work and organize their calendar, basically. And our doctors are completely independent, so they are in charge of their fees and their time and the services.
Yeah, that's brilliant. Actually, lots of doctors nowadays, because the client I work with, like doctor clients I work with, a lot of them are affected by IR35,
Yes.
the public sector thing. But with DocNoc, first of all, you are the private company.
Yeah.
And second thing, doctors are in charge of how they work, their fee. So actually, they can operate under the limited company in this instance.
Yes, absolutely, yes.
Yeah.
I'm sure there's lots of doctors that were affected with the IR35. Probably I'm one of them. Yes, as you all know, this legislation applies for if you work for the public sector. If you are an independent contractor and you work for the public sector, then you have to go into PAYE instead of being paid through a limited company. Because DocNoc is a private company, doctors who join us and work with us, they should be able to work through their limited companies. But as well, we always advise that to check this with an accountant first.
Yeah, definitely.
Someone like that.
Yeah, definitely. Of course, if you are interested in about setting up a limited company, once you are joining one of these platforms, and also be in charge of your fee or anything, or check if you are under IR35 or not, be free to let me know. But then today it's all about you guys. Okay, so when we talk about, make sure patients get access to doctors in a new way, are you really competing with NHS?
Not at all. There is a need there, and we're trying to respond to this need. Unfortunately, there is a need there because there is a lack of resources to the NHS, and there is increased demand, and that's a fact no one can change. What we are trying to do, we're not trying to compete with the NHS, we're trying to complement the NHS. And we believe any patients who can be seen through our platform probably will be relieving a little bit of pressure from the NHS. But the idea is, what we really want is, we want to develop a whole system operating digitally, where we can actually introduce to the NHS to improve access and flow of patients. We are not at this level yet, but that's our future vision as well. We want to work along the NHS and with the NHS, and we want always to support the NHS.
Wow, that's a really good idea. Like digitally, you're not competing with them, but eventually you can affect them, like make a big impact on them. So you talk a little bit about your vision. So just a bit more detail. What's your bigger vision, like for the DocNoc, and for how will it make impact?
So what we want is, we want to provide a holistic service. And when I say a holistic service, it means a service that takes the patient through a journey to better health. That includes initial consultation with the doctor, or even before that, that's preventative medicine, patients looking after themselves at home, looking after their own health, monitoring their own health. And if they need a consultation with the doctor, is to have a consultation with the doctor to have their investigations done in the community, to relieve pressure from hospitals and local community hospitals. We want investigations, referrals, monitoring to be done in the community, and all to be done digitally through one holistic system. And we strongly believe, if we can achieve that, things can change dramatically in the way healthcare is delivered. Because one of the problems is actually communication between patients in the community and their doctors. And until now, although there is some attempts, but there is no service that really caters to that. So that's what we want to do. We want to the patients to go to DocNoc and just feel that they get all the support and all what they need when it comes to their health, so they don't have to go and look in any different places or get confused about what they need. So we want to support them through their journey through one easy-to-use platform.
Yeah. I've actually heard a lot of patients actually check out their symptom on Google.
Yes.
So, of course, everyone, not just the ones who are seriously ill, everyone deserves being looked after in regards to their health. And this sort of holistic system can be one of the solutions.
Yeah.
So you mentioned about the benefit for the patients. Also, there's the other side for the doctors. How the doctors can stand out by using this platform?
Yes, our doctors in the UK are obviously, I'm UK trained doctor, and I think our doctors are one of the best in the world. The best not only in their clinical, but their devotion and their commitments to patient care. But unfortunately, there is a sense of burnout as well in the NHS among doctors, and low morals. And that comes again to the current situation in the NHS, poor resources, and doctors that feel a bit overworked and underappreciated. So what DocNoc can offer to doctors is an opportunity to be in charge of how they want to deliver medicine using available digital technology. And when we say available digital technology, we are talking about the future, how medicine will be delivered, and we want them to come along and become pioneer in this field. So doctors can join us, can choose when they want to work, what service they want to provide. They can set their own fees, they can organize their own work, and again, what they will benefit from is the holistic system that they can provide to their patients. And this holistic system is what will make sure that the actual service that is delivered is a good service and a good quality of care is delivered to the patients. And that's our priority from the patients and doctor side. So yeah, I mean, that's what we want. We want it from both sides, from the doctor side and from the patient side, both to benefit from what we are providing. And I would like to say, I mean, we are very open-minded for feedbacks from doctors and from patients, and we always take on board any advices or any if anyone has any idea how things can be improved. So again, that's our philosophy, and that's our strategy, that doctors, they are not left just register and work with us, but they partner with us, and they lead the way with us, and we decide what's best for our patients together.
Yeah, that's brilliant. Actually, when you talk about the burnout, from the client I work with, it's not new for me. It's working 7 days a week. I know how hard they work.
Yes.
But again, when it comes to serving the patients, for the person to be able to serve them better, then they have to be, in the good health condition.
Absolutely.
So I think that would be one of the solutions to benefit both doctors and the patients in regards to their well-being.
Absolutely, yeah. A happy, healthy doctor will deliver a better care than a doctor that is unhappy or, feel a bit underappreciated or under a lot of pressure.
Yeah.
And we want our doctors to be happy and comfortable doing what they do. They're doing already a great job, but we want to support them even more to do even a better job. Yeah.
And also, earlier on, we mentioned the alternative career and well-being for doctors. You are doing something about the award. So tell us more about it.
So yeah, we are nominated, myself and the company, for 3 awards on the ACW, and that includes Entrepreneur of the Year and Diverse Medic of the Year and another award, which I can't remember. Health Tech of the Year, yeah. And yes, we are, last week we were on top 4, and we would like anyone's support as well, just to push us up to number 1. So yeah, vote for us.
Yeah, of course. Of course, if you do need any more details, I put the link about DocNoc in our description, and of course, if you do need any advice on doctors when you join DocNoc and need some help about the tax, about your IR35, and be free to connect with me as well. My online community link is also there. So finally, after we've talked about DocNoc, is there anything you'd like to tell our audience about?
Yes, I won't tell them that our vision and what we want is really to provide good quality care, and our focus is always the patient and how they can get the best care that they deserve. We work for you, and we are to support you through a journey that can sometimes be difficult for patients with various illnesses, and yes, I mean, we will be always there for you.
Yeah, that's brilliant. And finally, if the patients or the doctors are interested in your platform, so what would be the best way to get in contact?
Yes, so we have, our website is live, and we have apps for patients and doctors on Android and iOS. So you can just download the app, just type DocNoc, and it will show 2 apps, one for doctor, one for patient. You can just download one of them, and I'll put the link for the website and with my email there as well. You can contact me straight directly through the email.
Yeah.
If anyone wants to speak with me over the phone as well, we can just contact me through the email, and then we can arrange for it.
Yeah, good. And Dr. No have something.
Sorry, it's fine.
some accident. Yeah.
And we'd like to mention that we're preparing a live event or a meetup. So watch the space, watch our Facebook page, and we'll advertise there where you can meet us face to face and do a presentation more on details, and we can hear your views and any questions. Yeah, watch the space. Thank you.
Okay, so watch the space. Okay, brilliant. So it brings to the end of our Q&A Monday for today. I think you guys has been really nice audience. There's no more questions. But if you are watching the replay, be free to put your questions in the comments so we can all help. Okay, so I hope you find this episode useful. As said, we will do more things, more Q&A live about healthcare, about what's going on in this space and how we can serve for doctors, like for their well-being, including financial well-being, and also how we can add more value to the patients, to the public health. Okay, thank you very much. Someone said thanks.
Yeah.
You're welcome.
Hi,
and I shall see you very soon. Bye now.
Thank you for listening.
Thank you.
Bye.
Bye.
Bye. Bye.